The federal government recently announced an excise tax on 10 naira per litre to be imposed on non-alcoholic carbonated and sugar-sweetened beverages. After the commencement of the implementation on 21st June 2022, the Nigeria Customs Service has revealed readiness to commence collection of excise duties from 21st of July 2022. Benedict Uko has more on this story.
The sugar-sweetened beverages tax was introduced in the Finance Act and signed into law by President Muhammadu Buhari on the 31st of December. The tax is meant to ease the suffering of people living with diabetes by providing healthcare services. At a meeting with high-level stakeholders on Thursday in Abuja to reveal the status of the act, the Nigeria Customs Service gave account on how far the service had gone after the implementation of the SSB Act, as they revealed the readiness to commence collection of excise duties from 21st July 2022.
Most of the factories producing carbonated drinks, sweetened beverages and all that have sent in their entry of premises, and that registration, we have done that. Now, if we inform them too that any production of these beverages, non-alcoholic beverages, sweetened sugar beverages, commence in effect from 1st June 2022. Now, today is already 23rd in the month of June. Then the implementation is ongoing. According to the law, Nigerian Customs and Excise Management Act, SEMA, Section 117, Subsection 2, empowers customs to collect the revenue from such return on 21st of the preceding month. So from July 21st, we'll be expecting such payment of excise duty on carbonated drinks into Federation account.
So we have gone for implementing the fiscal policy on 10 naira per litre on collection of excise duty on sugar-sweetened beverages. Implementation of the fiscal policy on 10 naira per litre has taken effect, and all those concerned will start paying their duties and will start getting their taxes, their duties paid, collected on or before the 21st of the incoming month.
The representative from the Ministry of Finance and other government officials spoke about the government position in implementation.
Finance Act is not a law on its own. It's meant to make some adjustment on the laws. You understand? And it's a continuous process. You understand? When there's a need to update any information that has to do with the public, the Finance Act do that.
The sort of fiscal policy framework for the country, because we have an accountability framework that we understand, and we understand where this money is going to go and what results we are expecting to see. So I do think that a tight handshake and a tight collaboration between health and finance is something that we perhaps can try to foster and make sure that these discussions aren't happening in the finance silo.
The civil society organizations on their part called for maximum collaboration for utilization and implementation of the Act.
Before the tax was introduced, maybe defining the mechanisms for implementation was something that had not been done at the time. So I think that's what led to the delay in the proper implementation. So, and I think that's also why we're here today, to really talk about, what are some of the mechanisms that the policymakers, such as the Ministry of Finance, can put in place to ensure that the implementation of these taxes are done efficiently and effectively if it's going to be a pro-health tax.
We have the same thing for diabetic patients. We have the same thing for patients battling with a lot of SSB-related diseases. How can we build an accountability framework that will be cut clear that this money will not be used for something else, that this money will not be used to buy project vehicles? Will this money be used to care for these patients? Across the country, only five machines or 4 machines are working. If you go to the hospital and see the long queue of our fathers battling with diabetes, trying to see geriatric doctors, we are not immune to this disease. I could be the next diabetes patient. As I'm talking to you, I'm even scared.
The meeting saw the representative from the Ministry of Health, the Ministry of Finance, National Assembly, Nigeria Customs Service, World Bank, and NSAR coalition, revealing how the SSB tax would gain maximum implementation in achieving universal health coverage. It is also expected that this could increase the revenue generation of the country.